I like to walk, and I got to where I could not walk because my legs hurt so much.
Hello, Myrtle.
That leg pain is what brought Myrtle Rowland to see vascular specialist Dr. Andrus Katz.
As you know, I like to shake hands, but I rather shake feet so I can feel your pulses.
Her condition, claudication, is caused by a lack of oxygen in the leg due to blockage in a blood vessel.
That blockage is due to a damage to the inner lining of the vessel that breaks the lining, and as the body tends to heal any break anywhere in the skin or in the vessel, platelets and products of coagulation become lodged in the area where the ulceration is. You don't walk outside, but in the house you can get and do your things and do everything you need.
Dr. Katz uses the patient's description of the pain for diagnosis. Pain from claudication is most often in the calves or thighs, and sometimes in the hips and back.
And it's very repetitive. That means that you never get it at night. You get it after you exercise.
The next step, a non-invasive ankle brachial study.
We check the pressures in the upper arm, in the upper extremities, and then we obtain the pressure at the ankles. And the pressure at the ankles should be the same or higher. And that ratio is what we measure. The ratio should be 1.1 or higher. When the ratio begins to drop, you know that there is a blockage or something limiting the amount of blood flow.
Patients with more severe claudication may need additional tests, including duplex ultrasound, MRA, or CT scans.
Claudication, the majority of the times, can be treated conservatively. The medical therapy consists of statins to control the lipids and the cholesterol, usually some sort of blood thinner to prevent the clumping of platelets in the blood vessels that are damaged by the arteriosclerosis, and an exercise program.
Some patients, however, need more invasive treatment, such as angioplasty with a stent or arterial bypass. While claudication is not a life-threatening condition, it may be progressive, so regular checkups are essential.
Most of the patients that have problems from arteriosclerosis will not suffer consequences from the claudication. They will suffer consequences from heart disease and strokes. It does mean that you have to check the risk factors, control them, and prevent disease somewhere else.
Ways to decrease risk for vascular disease include quit smoking, maintain a healthy weight, and control cholesterol and diabetes. An ongoing relationship with a vascular surgeon is important for people with vascular disease.
We take care of the patient from the beginning, from the medical part to the surgical part. Even though I'm a surgeon, my main objective is to keep the patients away from surgery.
Myrtle Rowland did need surgery, but following her arterial bypass, she no longer has leg pain.
I can walk, and that's the main thing. Dr. Katz has been a lifesaver to me. He really has.
Ask your doctor about your risks for vascular disease. Visit vascularweb.org to find a vascular specialist and learn more about vascular wellness.